Welcome everybody, and thank you for coming back for this final day of our string of events. I think we've said that the Carequality work started yesterday afternoon in the context of the RCE, which was a shared responsibility together with Sequoia Project. So hopefully most of you were here earlier, but for those of you who are just coming in today, welcome and thank you so much for coming. As Dave said, it's great to have all of you here to participate and discuss Carequality and help us to envision the year ahead. So let's go on with the slides here. Do we have a clicker? I'll do that. I'll bet green is forward. What do you say? Hints? Big green. Ah, got it. Okay, not the little green. All right, wonderful. So a little bit of a history of Carequality. I think we've really dawned in a lot of people's minds, recently as a key player in the interoperability workspace. But really, the history goes back a number of years, 5 years now, since the concept and the principles of trust were put together. And there was this first envisioning of a framework that would allow the networks to connect to one another. That framework was developed and fleshed out in 2015 in anticipation of the initial go live and live sharing of data in 2016. Over the course of the years, we've been building out the community, getting more and more participants coming forward and engaging in the framework. And then in 2018, really in anticipation of the work to be done as with the RCE and ONC, we separated out as an independent nonprofit, separating from the Sequoia Project as did the eHealth Exchange. This past year, we've done a tremendous amount of work, finalized the work of the Commonwealth Carequality Document Content Work Group and got ready to move that forward. We've been working on additional use cases and implementation guides and really seeing tremendous growth in participation in the framework. And now I think with the coming year, we're going to really start to deliver in an even bigger way on the promise that the framework offers us. Obviously, the work with ONC on the RCE is going to really continue to accelerate that. And I think those of you who were here earlier in the week heard that the eHealth Exchange is going to be implementing and able to exchange data across the framework come February, which is really, in my mind, going to kind of close the loop. We will then have all of the major networks utilizing the framework and really start to see even more ubiquitous exchange across the country. So this is the hockey stick slide that I think really demonstrates the impact of this framework. And it's important to realize that it's wonderful when you can connect organizations and stakeholders one-to-one, and you really do get to see some major impact there. But when you're connecting networks, the effect is really exponential. You get so much more bang for your buck. So, for example, bringing on Commonwealth and their ramp up of the use really, I think, has contributed to our growth over the past year. And I think once we bring on eHealth Exchange, we're going to see, again, just a continuation of this upward trend. And it's very heartening as a clinician to see the value of this exchange. And in fact, I'm going to talk a little bit about our experience at Sutter Health in Northern California, a large integrated system. This is our data. And again, as you can see, there was this early adoption of interoperability where we were doing mostly exchange using our EHR vendor. And then as additional tools, including Carequality, came online, we really saw this tremendous upward tick in growth. It's a little, that bump toward the end there is actually just an artifact of some technical things that our vendor was doing. But really, you see this steady growth. I had the pleasure of participating in the very first exchange over the Carequality framework. Our organization, actually I queried an Athena Health user for a shared patient, and we were able to get that get that up and running. So this has been an exciting process. One of the things that we've seen, as I said, we participated in a lot of same vendor exchange. So if you look, that green line at the bottom has to do with the number of trading partners that we interacted with in my organization over the years. And for many years, it was mostly with trading partners that were using the same vendor's EHR. But then as Carequality really came on board and more people were adopting, what we see is this increase, this dramatic increase in the number of trading partners who are using using EHRs from other vendors. And we anticipate that will simply continue. This is a slide that talks about the number of linkages. We refer to linkages as when a patient's record in our system is connected up with the patient's record in another system. And what this shows is that, while we have, a couple million folks who have a single linkage to a single outside organization, actually the majority of our patients have multiple linkages because at least where we are, and I think in most places around the country, patients move around, they receive care in multiple locations, and they simply, move from one part of the country to another. So when I see patients, it's not at all unusual for them to have 4, 5, even 10 linkages to other organizations, where bringing all of that data together into a single view really facilitates coordinated and safe care. This starts to break it down without naming a lot of names into the various vendor systems with which we exchange. So the big red there on the left is our exchange with folks using the same vendor system, very ubiquitous system, so it's not surprising that still makes up the majority, and in California that vendor is pretty predominant. But we also have a large proportion of our exchange with the record locator service that's offered through Carequality, and that gives us a lot of additional information. When we ping the record locator service, if there is a connection through Carequality to the source system, it then automatically goes out and grabs that data. And then, a substantial slice of the pie is sort of straight Carequality system-to-system exchange, which is spread across a number of different vendor systems. So, it's been exciting to see this diversity of connectivity grow over time. So really, this was a quote from a class report on interoperability that came out a little over a year ago, and they were really celebrating the connection of Commonwealth becoming an implementer on the Carequality framework, which again has really broken down a lot of the historic barriers in terms of exchange between some of the major vendors. And I think that as they said at the bottom, and again this was published I think a little bit over a year ago, the biggest barrier preventing widespread participation are governance and the need for organizations to decide to participate. And I think I stood in this same room a year ago and talked a bit about this, that it's really important that we encourage, obviously all of you have drunk the Kool-Aid, you understand the importance of this, but reaching out to folks in your communities and assuring that everybody is going ahead and flipping the switch and putting this into place so that we can deliver on the promise and on the functionality that this provides. So we've had tremendous growth, as I said, over this last year. At this time last year, we were exchanging across the framework 14 million documents a month. Now it's over 80 million. We had 14 live implementers. We're now at 22 with more than that in the queue in the process of implementing. We recently signed 3 major vendors to implement our image exchange functionality, which you'll be hearing more about later in the day. And now we're up over to roughly 500 million documents exchanged since our initial go live. So really seeing impressive growth across the group of participants. We have also made, as I said, we separated off from the Sequoia project, so we brought on an initial board of directors to get things going. We have a number of work groups working on new implementation guides and use cases specifically around push messaging, around using the ability to use the framework for exchanging FHIR resources and using FHIR-based queries. And then we are doing updates to our implementation guide. For those of you who are staying around, we're going to have a panel on the implementation guide changes later in the day. I mentioned the image exchange work that we're doing, and that also involves the development of a new implementation guide. And this work really has involved a tremendous number of volunteers, many of you who've participated in our various committees and work groups. It's really been a coalition of the willing who've been doing this work, and it's been very, very fruitful what all of you have been able to accomplish. We wanted to call out our current board. There's probably going to be some shifting in the coming year. This was our first year board that we put together, but I think a number of these folks are in the room. I think Seth is here. Dave has been supporting this. I don't know, Mary Ann, are you in the room? I don't. She's got a lot going on. Hans has been here this week, and I know Michael Hodgkins has been participating remotely in a number of our meetings. But this group has worked very hard to try to get the organization on its feet, but the real work is being done at the steering committee and the advisory group level. It's sort of it's an artifact that I chair both the board and the steering committee that's in flux at the moment, but Michael was chairing this group through most of this year, and again, it's been very helpful to have the participation of these various stakeholders in trying to steer the functionality and the direction of the group. And then the advisory council is a larger group. We've actually got 2 slides here of the many people who have been participating. So if you're involved in the advisory council or the steering committee, could you just raise your hand briefly? We've got quite a number of people here in the room. And again, real thanks to all of you for your participation and contributions here. So looking ahead, what do we anticipate in the year ahead? Really, as I said, we've worked through a number of updates to the implementation guide, and that's going to be coming online. That will support additional functionality. The imaging use case, really, which has flowered in really a very short period of time as something that our ecosystem, our industry really needs, is going to be ready to go live this coming year. Much more quickly than the early implementation guides. Our firework group recommendations are going to be coming forward, and hopefully we'll see some initial use of that. And really the key with Carequality is responding to the needs of the market, responding to the needs of all of you and your customers and implementers out in the environment. Obviously, the Trusted Exchange Framework Common Agreement work is going on in parallel. There was a very conscientious decision made that we wanted to continue to support the ongoing operations of the framework to meet the needs of our users, independent of the TEFCA work, because they really demand a different kind of a focus. One is very much in the startup and envisioning phase, while the other is really in full production and very much in a growth mode. So have no fear. Production operations will continue to be supported through all of this as we move forward. Having said that, I think the opportunity to really provide the framework for TEFCA, utilizing and building on the experience that all of you have had and that our community has had, is a really wonderful opportunity. So those are the end of the opening remarks. I think we have time for some questions if anybody has any. Otherwise, we can head into the day. Is this a question? Wonderful.
Hi, John Lunsk. This is really spectacular progress, and congratulations on this work. I wonder, I have a question about the policy side of the framework, and specifically the fact that both Commonwealth and eHealth Exchange have business associate relationships with all of their participants. And we have found that helpful in the public health context in our work with eHealth Exchange, because it helps build policy scale. So I'm wondering if that has been considered as a policy exchange level across Carequality to be able to manifest those business associate relationships as well. And
so I can take that one, I think. There's a fundamental difference there with the eHealth Exchange and Commonwealth both. Certainly Commonwealth has always had this, and the eHealth Exchange now with its hub, in that they are themselves party to the transactions. They are handling one way or another, even if in a transitory fashion, patient data. Carequality is not. So Carequality would not expect to be a BAA for any of its participants, stated loosely. But perhaps that's not what you're necessarily
And that's not exactly. What I'm trying to ask, perhaps inarticulately, is whether not that Carequality would be a BAA, but whereby the BAA authorities could be exchanged between networks like Commonwealth and eHealth Exchange. That's a missing piece in some of the applications, I think. And
Can
so
you say a
it
bit
wouldn't
more?
necessarily be the
Yeah, can you elaborate a little bit on
The benefit.
Well, and also maybe I'm just being a little slow on what you mean by exchanging the BAA. I forget the exact words you used.
So we have we now have a relationship, a contract with eHealth Exchange, whereby we can provide public health services, electronic case reporting specifically, to any eHealth Exchange participant. And we do that by virtue of technical connectivity, but also by the fact that the business associate relationships enable that. So we have a platform, and it provides those services accessible to anyone on eHealth Exchange. It would be nice in the future if that, in the network of networks concept, that those services could be provided out to others, like those that are on Commonwealth as well. To do that, that business associate relationship has to be manifest across that exchange. And that's what I'm trying to ask.
Okay. That I would have to, I know enough to be dangerous about legal things. I play a lawyer sometimes on TV, but for that one I would definitely have to consult with Steve.
And I've been
Gravely.
dangerous in this area for a long time, so. But it's just, I wanted to put a bug in your ear about it, because
Yeah.
I think it is a consideration as we move forward into this new world.
But I think your goal is quite laudable, which is to say what you've been able to do across the health exchange, you'd like to be able to leverage across the entire framework.
And we would as well. So we should touch base offline with Steve and talk about that further, I think. But thanks
Excellent. Thank
for
you.
bringing that up.
Great question.
Hey, this is Tiffany from Denver Health. I know that you mentioned TEFCA, but where do you see Carequality moving in TEFCA? Are you going to talk about that today? I don't want to jump to that, but just curious where that's going to go.
Yeah, we wouldn't necessarily talk about that, so that this is as good a time as any to bring that up. So as Stephen just indicated, right now Carequality is full speed ahead. There are a lot of unknowns around the TEFCA ecosystem and that work. We're very engaged in it, very positive about it, but at the same time, there's a lot of unknowns, and there's a very wide spectrum of possible outcomes there. While we're hoping for the best, we want to make sure that Carequality is positioned for success regardless of what happens with TEFCA. Now, if the TEFCA ecosystem and the QHIN network are taking off and Carequality implementers are becoming QHINs or are working with QHINs, it will likely make sense to have a very deliberate and intentional transition strategy for how we would basically roll Carequality operations into the TEFCA, perhaps with Carequality continuing to be a little bit more groundbreaking and as we've been doing with our work contributing then into the TEFCA ecosystem. But one way or another, again, if the TEFCA is ultimately showing success and appears to be filling the role that Carequality would fill, I think we would look to roll the operations into that ecosystem rather than have two parallel competing ecosystems.
Great, thank you.